Hereditary hemorrhagic telangiectasia is the second most common hereditary bleeding disorder in the world, but it has no FDA or EMA approved therapies, and there's really quite a lot of unanswered questions in HHT. One of those major questions is how well patients tolerate antithrombotic therapy, antiplatelet therapy, and anticoagulation. And right now, the HHT guidelines that concern the use of antithrombotic therapy are based pretty much entirely on expert opinion alone. Very little data. There is some data, small case series, cohort studies. And so the study that we did that I'm presenting on at ASH this year concerns really the largest cohort of patients receiving antithrombotic therapy with detailed patient-level data that's ever been done. And this study was quite remarkable in just showing how poorly about half of patients with HHT tolerate this therapy, and how there is really a strong need for intervention to help improve bleeding control and facilitate use of anticoagulation, antiplatelet therapy in those patients with HHT who need it. And we have to remember, HHT is a hereditary bleeding disorder, but does not reduce the risk of thrombosis. In fact, quite the opposite. It increases the risk for both venous thromboembolism and arterial thrombosis. So these drugs come into play very commonly in the treatment of patients with HHT, and this data will help practitioners know their likelihood of success and help them choose agents when they are prescribing antithrombotic therapy for patients with HHT.